IOP is Intensive Outpatient Program. At Sandstone Care, we run 12 hours a week for about 10 to 12 weeks.
An IOP level of care is a really great balance because it gives folks the opportunity to still participate in work, in school, and then also get the support they need in the evening hours.
We developed a young adult track, which was designed for 18 to 30-year-olds, and then a adolescent track, which was designed for 13 to 17, and in some cases, depending on maturity and circumstances, an 18-year-old.
We know that the longer you're in treatment and the more robust treatment is, the more successful you'll be long-term. We think that 10 to 12 weeks really is robust enough to give the skill building and the practice to both the client and the family to make them successful long-term. We run 4 days a week because we know that you need a day off to do other things, to practice those skills, so that when you come back on a Monday, we can talk about what worked and how we're gonna boost the things that maybe didn't work as well.
It's comprehensive and multidisciplinary in that we offer the individual sessions, group therapy sessions, family therapy, academic vocational support, and psychiatric support.
With individual therapy, the reason why that is so important is because the client needs that time to themselves with their counselor to be able to have somebody that they can establish rapport with, someone they can trust.
Group is great because you get experiences from people that are in your similar situation, right? The therapist might have the same experiences, might have the same culture background, but it's such another thing to get experiences from people that are going through the same thing at the same time and are the same age.
They get to come what we call multi-family group, and they get to be in there with their own family of who their choosing is, and then all the other clients and patients that in their families to get to grow and learn together with them. And on top of it, they also get to have individual therapy with their therapist and individual time with their family therapist as well.
All of our outpatient centers have an academic vocational advisor that works with our clients in a variety of ways. For adolescents, it can be tutoring, it can be homework help, it can be helping them with an upcoming test that they have.
Our young adults, we help them with assisting with finding a job, with vocation. What is it that you want to do? We also work on soft skills like eye contact, the way that you sit, the way that you dress. We also focus on resume building and telling them, okay, these are the things that you want in your resume so it can stand out. We want to be able to show employers that you are employable with the skills that you do have.
So you will have a group setting for 3 times a week for 3 hours each, and then you will have your individual sessions with your primary therapist. It will be bi-weekly. Also, you will have your multi-family group, which will also be every week, and then you'll have your individual family group, which will be bi-weekly.
They're gonna work with a clinician on a lot of skill building, which could be distress tolerance skills, it could be coping skills, communication skills.
So your overarching topics are gonna be things like trauma, triggers, emotional distress, and we're really gonna hit on specific points that encompass your diagnosis.
Then they're gonna have some open process time where they're talking with their group and the clinician about what's been going on for them. How does it feel to use these skills? What is getting better? How do we build on what's getting better? And then they're gonna have the opportunity to close group with what are their intentions, their homework, what are they taking away from group, how will they build on that?
It doesn't matter if you're in the young adult program or the adolescent program, we do activities. We help you practice your skills. And yes, every once in a while you get some homework to do too.
So after IOP, we would ask that clients step down into what we call a general outpatient level of care. And so statistically, we know that if clients step down into an aftercare program, they just have a better chance of long-term success.
We know it's vitally important that you have a connection with not only an individual therapist in your community that you feel safe and connected to, but also with an alumni group. Sandstone Care has an alumni group, which has proven to be very successful. They love having a group of supportive people who've been through something similar to them. There's also a lot of community resources that we help connect people to so that it can be something that you as the client feel really empowered and comfortable and safe with.